today I will discuss our research on mental health of teachers from a comparative perspective, not only our research that we did on TALIS, but also a bit broader. A large part of my career has been built on basically finding nothing. The null results are also important in science, and today I will talk a bit about that nothing, and I hope you can or will enjoy what we have to present. So 12%, that is the proportion of the higher educated workforce that is a teacher. So that means that 12% of all higher educated employees are teachers. So that's really a massive number of people in education. This 12% is the number in my region in Flanders, but it's quite comparable across the world. So in Flanders, 164,000 people are working as a teacher, and that's on 1.3 million higher educated employees. It also means that the education sector is the largest employer of higher educated labor. So that has some implications. So the thing that it's a large number of people that work in education already shows it's an important sector. We really pay a lot of attention to our educational quality, what education should do. We have a lot of people have strong opinions about what education should be for. It should focus on training new generations to become good citizens, or more on the labor market, that we prepare students for labor market entry. But regardless of what we focus on, the purpose of education, it is clear that there's a share of people working there. And because of
Philip, can I just interject, because your sound is not very clear, so make sure to speak kind of into your microphone clearly, and yeah, maybe not rustle papers or anything. That might help too, perhaps.
Yeah, I'll try to focus on my microphone. So because of that importance that we give to education, it's also clear that each one of us comes in contact with education. We have been to school ourselves, or we send our children to school. So a lot of people have strong opinions also about what education should be, what educational quality should be, and so on. And it also means a lot of people have strong opinions, but we also see that among teachers, and it's quite particular or quite interesting phenomenon that teachers regularly write opinion pieces about their own profession. It's one of the only professions that does that. In Flanders, we see it, that every once in a while, every couple of months, teachers write opinion pieces about the quality of education, their working conditions, or when they disagree with policy. And that also means that because this workforce of teachers is so large, that it's quite easy to find support for opinions. So if I would say, for example, that the teachers disagree with a new blended learning style, then it's very easy to find dozens, even hundreds of teachers that will support my claim. And that is perfect breeding ground for creating myths or creating truth because of repetition. And I would like to look at what we do for mental health on that level. And that is, if you look at the newspapers in Belgium, but also across the world, then regularly you see claims like that teachers have most chance on burnout in education, that the prevalence of mental health problems is highest in education, that teachers are crashing mentally, that there are record levels of stress. So in the public debate, in the media, the impression is given that teachers really suffer from a lot of stress, and often also that they have more mental health issues than other occupations. And that's not only in the public debate, but also in the academic literature, we find support for those claims. It's often, if you just look for a paper on teacher stress, teacher burnout, and often they start with claims such as these, that a body of research indicates that teachers are more vulnerable to stress, burnout than many other occupational groups. And it's not uncommon. I mean, if you really look on most papers, they start with these kind of statements to create the relevance of their study, and often they make claims like these: that teaching is particularly stressful, that is one of the most stressful occupations in the world. So also when we started with our research on mental health, that was what we were expecting. We thought, okay, teachers are really burdened and they're really suffering, so we really need to look into getting insight in the causes and conditions of their mental health problems. So, but we were neurotic enough to look at the references that should support these claims, like the first one, for example. Then we looked at the reference that should support this claim, and we were quite surprised that most of these studies that were cited to support such claims are not really comparing teachers with any other profession. So that made us wonder what is going on there, and that is why we focused on a basic question: if teachers have more mental health problems than other occupations. So we wanted to find it out, but before we look into our research for that, I present you the experience of work stress based on the Teaching and Learning International survey, for which we did the Flemish implementation. And what we see there is the average across OECD countries. So in total, it's in 48 countries and regions, this survey. But in the OECD average of 31 countries, around 18% of the teachers indicate that they experience a lot of stress. And if you look at the Netherlands, that's around 10%. And if you look at my region or countries like Portugal, England, and Hungary, then around 30 to 40% of the teachers indicate that they experience a lot of stress. So what you see here immediately is that there is variation. There's variation between countries that can point to differences in policies, working conditions, different cultures, whatever. But it's just important to notice that there is a lot of variation in what teachers report. And what we are interested in, or what we wanted to look at, is that a lot of stress is within a country like Flanders, where 28% of the teachers report a lot of stress. Is that a lot? And to be able to research that, to investigate that, then we actually have to compare teachers with other occupations. So why do we need comparative research? Well, a very important reason is this repetition, truth by repetition, that there's a risk of creating self-perpetuating myths. When really a lot of people are repeating certain claims in the media or in academia without really having the evidence for it, then there's a risk of getting into myths. But maybe more importantly, if you can identify the relative position of teachers in comparison to other occupations, then it also has a lot of implications. Like if we find that teachers indeed have worse mental health than other occupations, then there is evidence that it is a teaching specific problems, and we should look for solutions within the teaching profession. Like maybe it's due to intensification of the teaching profession, administrative burdens, whatever can play there. But if we don't find differences, then it more points to common tendencies in the professions, and policymakers should more focus on global policy that can help a lot of professions. So it has important implications. So we start from the idea that it seems widely accepted in the public domain amongst policymakers, amongst teachers themselves, and also academic researchers, that teaching is a particularly stressful occupation. But what does the evidence show? So this is based on a study that we did in 2015, so it's already 7 years old, but I will also present some new data, and that basically confirms our position. So what did we do in this study? We made a review of existing mental health research, where there was actually a comparison between teachers and other groups. And in the second step, we presented a new study based on the national representative sample of the Belgian Health Interview Survey. where you really have a representative sample of the Belgian population and also of the occupations of the people. So our first review showed that we found around 28 studies, and a lot of them were quite outdated, more than 20 years old. Often one-item measures were used, or there were non-peer-reviewed reports, and often convenient samples were used to compare, for example, a sample of teachers in a certain city with then a sample of nurses in another city. Sometimes even years were combined, and that's not ideal or creates potential methodological issues. Also, what happened often was that a broad range of occupational categories were combined into one comparison group. So what we also found was that the results were basically quite contradictory, taking into account all those methodological problems. Sometimes we would find that teachers suffer more from mental health problems, sometimes they didn't. And that, of course, is related also to, to all the methodological problems that I just explained. So we wanted to do a new study that took into account some of these limitations above. So therefore, we used the Belgian Health Interview Survey, which used face-to-face interviews, and we pulled some data together from different ways. Why? Because then we were able to compare teachers with 31 other professions and see what happened there. As outcomes, we looked at a wide range of mental health problems like psychological distress, anxiety, depression, sleeping disorders. We used validated cutoff points from the Belgian Health Interview Survey and used logistic regression. So what did we find is, you can see where I can put my laser pointer. So it's a very long table because it's 31 professions, so I cut it up. But we basically find that teachers do not report more mental health problems than the other occupations. What we did find is that also what you would expect from epidemiological studies and also from sociological insight is that those people who work in jobs for the lower educated, for example, people on assembly lines, domestic cleaners and so on, those clearly reported worse mental health problems than teachers. And this is quite logical also. We know from epidemiological research that the lower educated, that they have more, they're more likely to report depression, anxiety, have a lower life expectancy, and so on. And so we see that also reflected in the jobs. There was also no difference between teachers and social professions. So for this part, we concluded then that teachers do not seem to report more stress, depressive symptoms, anxiety, and so on than other professions. And the professions that you would expect from epidemiological research do report more mental health problems. So what does other research since then says? And also maybe there's a question like, okay, aren't there then maybe changes over time? Well, our colleagues that also implemented the TALIS survey in England, Professor Jeremy and colleagues, they did some studies on the available evidence in England, and they combined data from 11 databases and so on. And I'll present just a few of these figures because they do say a lot. So we see here the bold line are teachers, and here it's the percentage that is reporting long-lasting health conditions. And then we see that teachers don't really differ from human resources or other professions. We see the nurses take the top position in the percentages. We do see an increase in that there's a higher prevalence that is being reported in these issues, but this is a tendency that we see for most professions. So we see that it's more of a common thing in our society. Second figure shows similar pattern that here it's the reporting of long-term limiting mental health problems, and there we also see clearly a rise, but this rise is also visible in other occupations, and also here again teachers don't really differ that much from other occupations, and nurses again take the lead in this ranking, but the variation between different occupations is quite limited. And it goes from 4 to 6%. Then another one is on the percentage of illness made worse or caused by the jobs, or also here we see there's actually not so much difference between teachers and other occupations. The same for depression. We see it's a bit higher here, but if you look at the pattern long term, then we see that teachers don't really differ from other occupations, or at least not disproportionately so. Then we also looked at, okay, maybe there are other indicators that maybe we can also look at the other side of workability, of job quality indicators. And for that, we use the Flemish Workability Monitor. It's also a representative sample of the working population in Belgium. And there we looked at comparing again teachers with different categories of employees. So here, for example, it's the problematic workload that workers report. And we see that teachers do not differ significantly from other categories like manual workers, office clerks, healthcare professionals. But we do see that management, middle and higher management employees, they report double as much problematic workload. If we look at another indicator like autonomy, then you see that teachers don't, when you compare it to other occupations, don't report so much a lack of autonomy. It's mostly people working in manual labor, office clerks, or healthcare professionals that report much more a problem or a lack of autonomy. Teachers are more in line with middle and higher management. The same for task variation. We see that teachers are on the same level of middle and higher management and have much more task variation than manual workers, office clerks, and healthcare professionals. Same for learning opportunities. We see the same pattern. Teachers are aligned with middle management, but do differ from other occupations. So there are some conclusions. That the first one is that we would really caution against the creation of these kind of self-perpetuating myths, which are not based on facts. Just by repeating things in media, that you can get a social narrative, and also in academic literature, but it is really necessary to look at the facts. And then the widespread idea that teachers suffer from more mental health problems than other occupations does not really seem supported by the available data, or at least all the data that we looked in. And especially also if you look at job quality indicators, then also teachers don't jump out. If they do jump out, it's in a positive way. Indeed, they score high on things like task variation, learning opportunities, and those are all associated with having a good job, a high quality job. And so there's all tendency of giving a lot of attention to the educational sector on these things, like that you see in media reports and but also in academic literature, can have a perverse effect. It means that there's less attention given to maybe less vocal employees. I've never seen a cleaning lady or man write an opinion piece about their working condition, or assembly line worker that writes an opinion pieces about their working conditions or policy changes. No, they're less vocal, they're less educated, and often are also working in more precarious working conditions. So that can have a bit of a perverse effect if we do give disproportional attention to the education sector and the idea that they have more mental health issues, when in fact they seem to not have that. And that is also what our colleagues in England, Professor Jerwin, concludes, that the research in this area should now shift away and from the idea of, do teachers now have more mental health problems than other occupations? I think there's just not a lot of evidence for that, and that we should shift to focusing on the drivers of mental health problems within the education sector. So that's also what we then wanted to do. It's not that the education sector does not have problems. That's obvious. It's important to look at the mental health problems within the teaching profession, but I think it's important that we not over-exaggerate the relative position of teachers, and that it's clear that they don't take in a unique position in the spectrum of occupations, especially the higher educated occupations. So that is what we wanted to do in our second study, then look at take a comparative focus within the teaching profession, and there we want to look at differences between schools, because that's then where we can find a lot of good reasons why there would be differences between schools, and it's also something that policymakers can easily or relatively easily influence. So does the school context matter for teacher burnout and stress? This was published in an educational researcher recently, so you can also always read our study. But why do we expect differences between schools? Why this comparative focus? Well, there are very good reasons to expect differences between schools. There's a lot of theories like social disorganization theory, job demands, resources model on an aggregated level, for example. But they all boil down to the same idea, and that is that the degree to which the organizational context is unfavorable, that this can increase stress of individual teachers, and that this ultimately could lead to burnout. Imagine if you're working in a school and you have the principal is really not good at leadership, there's not so much social support among the teachers, it's maybe a very challenging school. Well, then you could imagine the teachers working there maybe suffer from more stress and a more challenging context, more than, for example, a teacher working in a school that has good social support, really good leadership, maybe students that really excel. You could imagine that that's maybe less stressful. So this is what then we wanted to look at. Does the school text matter? And we look specifically at teacher burnout because it's one of the most popular outcomes in teacher mental health research. It's also interesting that you don't really have burnout samples on an epidemiological level. That has to do, I think, with the quality of the scales also. But it's another discussion. But in any case, the ones that created a very popular burnout scale, the most popular one is Christina Maslach and later already in their research agenda in 2000, now 20 years ago, emphasized the role of the school context. They point to things like student composition, principal leadership, organization of work, where Maslach also concludes in 2001 that situational and organizational factors play a bigger role in burnout than individual ones. And that's also what you would expect, because burnout is a work-related construct. It's specifically defined like that. It's a work-related mental health problems that exist out of three dimensions: emotional exhaustion, depersonalization, and reduced personal accomplishment. So it seems self-evident. There's very good reasons that there are differences between schools, but what you need if you want to investigate differences between schools and look into that relevance of the school context, then you need multi-level research. And it's really crucial to investigate the relative importance of the individual and school level. So in multi-level research, we are able to separate the variance between the individual level and the context level. So for any outcome like emotional exhaustion or depersonalization, we can see how much of the variance in that outcome can be explained by differences between schools or differences between individual teachers. So you really need this method, multi-level analysis, to investigate something like that. And there we use an indicator, the ICC, the interclass correlation coefficient. It basically tells you how much of the variance in an outcome, like burnout, can be explained by differences between schools. To illustrate that, here you see situation A, where you see, for example, two schools. So here you have the scores on emotional exhaustion, for example, and then you see that the red school, the dotted line, and is the average, clearly has higher average burnout than the blue school, right? And the ICC basically expresses the relation between the difference between the averages of the schools and the relative relationship with the differences between the individuals' scores. So, and what you see here in figure A is that there's very little overlap between the schools. So the blue and the red school basically don't overlap that much, only here a bit. So that would imply a large ICC, and then you would say the school context clearly probably has something to do with this, because teachers on average in the red school are really suffering more than the teachers in the blue school. So maybe that's related to leadership styles or how the school is organized and so on. But then if you look at situation B, then we see that the blue and the red school, that there's a lot of overlap in the variant of the variation in the outcome of, for example, emotional exhaustion. And in this case, we wouldn't say that there's large differences between the schools, and the school context doesn't seem to matter. So we will look at this ICC, the interclass correlation coefficient, and focus on our research question: how much evidence do we have that the school level matters? And for this, we do two things. Again, we do a critical review of all the studies that we could find on teacher burnout, but that uses multi-level research. And then we also use new data from the Teaching and Learning International survey to investigate these dimensions of burnout. Now, we did a comprehensive search. We found around 4,000 articles between 1974 and 2019. They had to be English in peer-reviewed journals. They had to have a measure of burnout, and they had to use multi-level analysis. Now, what does the review reveal? Well, the first finding that we had is that most studies that investigate the school context, so they, in their title or in their abstract, they say that they investigate the school context, they only rely on individual level teacher data and apply single level analysis. Now, that is in a sense problematic, because then you're basically making claims about the school context when you only have data on an individual level. In the literature, this is called atomistic fallacy, the opposite of the better known ecological fallacy, and that's basically that you are drawing inferences on another level based on data from another level, and that you really can't do. And of course, that has implications also, because we often see in these kind of articles that in the conclusions, they often make suggestions about what schools should do, that maybe they should do a different type of leadership, or do a reorganization or whatever, but they really make claims or statements about what schools or school policy should do, while there's not really any claims they can make on these kind of data. And so we saw a lot of conceptual confusion, and to clarify that a bit, we use the framework of Chang from 2009, and Chang makes the distinction between three types of factors. So the first one is individual factors, and that's the question, who becomes burned out? And that's so really on the individual level, predictors like age, gender, work experience, individual factors. In the second level, you have transactional factors, and that's how teachers experience aspects of their work environment. So here it's about perceived social support, perceived leadership style, but it's really important to realize that these are still measured at an individual level. So it's teachers, their individual perceptions on leadership style, and it's most of this research here uses these kind of transactional factors, but it's still measured at the individual level. So these are individual level results and claims. Then a third type of factor is what would answer the question, in what context do teachers become burned out? And that's all the indicators, structural ones like student composition, leadership style, but these are then measured at the school level, or these are aggregated from transactional or individual variables. Like if you take the average of perceived leadership style in every school, then it becomes an organizational factor, and then you can perform or conduct multi-level analyses and say something on the relevance of the school context. So, but I think it's an important issue that we see a lot of conceptual confusion, and especially transactional and organizational factors are often confused with each other, and claims are made which really can't be made with the type of analysis that is conducted. So we did our comprehensive search, and in the end, we only found 14 studies that use multi-level methods, which is really extremely scarce if you think about the 4,000 articles on teacher burnout, and especially also the theoretical idea of burnout being a work-related problem that is influenced by the work context. Then only finding 14 studies is a bit low. Now, what we see is that also these studies vary a lot in methodological quality. Some of them don't use validated burnout scales. A second point that's a bit technical is that the magnitude of school level effects are often not taken into account. So Merlot makes it very clear in his article that it's really crucial if you look at multi-level studies and you report something like a general contextual effect, like the ICC, then you also need to when you focus on predictors and on a school level, for example, you need to report the specific contextual effects, and what he means by that, standardized coefficients. Why? Because there is a relationship that if your ICC becomes very small, there is a higher chance that your effects at school level or context level become significant. So then you have the risk that you have significant but potentially trivial or meaningless results. And to avoid that, you can use standardization. That's maybe a bit technical, but more importantly, what we found when we looked at the ICC of the unconditional model, so that's just running it on the dependent variables without any predictors, then we see that for emotional exhaustion, 1 to 6% of the differences in emotional exhaustion can be attributed to differences between schools. For depersonalization, it's 0 to 8%, and personal accomplishment 0 to 3%. But of course, there's also a lot of methodological problems. Sometimes the number of schools was only 13, some had 583 schools. Sometimes the average number of teachers per school was 2, sometimes 58. And you can imagine if your average number of teachers is 2 per school, then of course the responses of those teachers will influence the average of the school, and you can inflate your ICC. And I think the most important part is that none of these studies aim to be representative nationwide or used a two-stage probability sampling design. What we mean by that is that, for example, you take a random sample of the schools in your population, and then within those schools, a random sample of teachers. And as a last methodological issue was that often different educational levels were combined, primary and secondary education, also different type of schools were combined in their research, and that also can create a bit of an inflation of the differences between schools, because primary and secondary education are different contexts. So we think we should separate that. So what we did in the end was provide new data, and I think this is at the moment the highest quality data on teacher burnout currently in existence in the world, and I'm very careful with that claim, but it's based on the Teaching and Learning International survey. We could add some burnout scales at the end of the survey, and we did so for Flanders and Wallonia. So the TALIS survey has to meet high quality standards. It's representative at the teacher and school level, so it's a two-stage probability design. And so we have data for 2,300 primary teachers in 180 schools, 2,700 lower secondary teachers in 190 schools, and in Wallonia we also have 2,100 lower secondary teachers in 120 schools. So what did we look at? Well, first, we used the Maslach Burnout Inventory, the educators survey. Well, that's the most popular outcome for burnout, teacher burnout in teacher research. And we looked at first an unconditional model, so without any predictors. And then we looked at a model including the most important individual level variables based on a meta-analysis. And then we also included some school level variables, structural ones like percentage of students from socioeconomically disadvantaged homes, or whether teachers were intimidated or experienced verbal abuse, and also a school policy measure, which was related to collaborative school climate. So that's the idea that teachers recognize that they work together on issues, that they have a say in policy, and what is called collaborative school climate. So what were the results? Well, we see here the ESET1 is primary education, here lower secondary education, and then for the Flemish French-speaking community. And we see the ICC, this is the results from the unconditional models. We see for emotional exhaustion, for example, that ICC is 5% in primary, 2% in lower secondary, and again 5% in lower secondary in the French-speaking community. For the personalization, it ranges between 3 and 4%, and for personal accomplishment, around 0 to 2%. And what is really important to realize here is that, for example, this 2% of emotional exhaustion, that means that from the 100% variance in emotional exhaustion, only 2%, so that's a very small part, 2% can be attributed to differences between schools. So that also means that if you can imagine all the possible school level variables like leadership, composition, whatever you can think of, that will only explain this 2% of the variance in teacher burnout. So that's a very important thing to realize, that is what these ICCs in the end say. So then we introduced our predictors, and then we see some clear patterns, like if you introduce aggregated collaborative school climate, then we see a clear pattern that in those schools with a higher collaborative school climate, on average, those teachers will report less emotional exhaustion, less depersonalization, and more accomplishment. Similarly, for percentage of students for socioeconomically disadvantaged homes, you see what you would expect, that in most of the context that we did this, we see that schools with a higher share of these more challenging students, then we see more exhaustion, depersonalization, and less personal accomplishment. So what can we conclude now about this? Well, I think, again, that the widespread idea that the school context is important to prevent teacher burnout does not really seem supported by the evidence. We really see only small percentage of the variance in our outcomes can be attributed to differences between schools. So there's also, that is the implication, that there's little empirical evidence to substantiate school level interventions. For example, that we would say we have to change how schools are organized, or we should do interventions only on schools with a challenging school context, because we see that in a lot of teacher burnout research that the variable of socially disadvantaged homes has indeed an effect on your emotional exhaustion. And then we could say we're going to do an intervention and we've only focused on these type of schools. But if you do that, because the differences between schools are so small, then you will neglect a large share of teachers with high levels of burnout that will not get this intervention just because they are not teaching in these kind of schools, while there are also, given the variation at the individual level, many teachers suffering from burnout that are not teaching in such schools. So how can we explain that? Because for us it was also a bit puzzling how come that there's so little differences between schools. Well, one explanation is that teacher burnout is mainly an individual phenomenon that would be in line with the transactional model of stress from Lazarus, where you see stress as something personal, how you appraise stressors yourself. And in a sense, it's also not so unlogical. If I think about my own childhood in education, then in some classes we were really making a tough environment for teachers, and we were wildlings and making a lot of problems. And I think for those teachers, we were a real source of stress. But then the same students could go to another teacher, and that teacher had a lot of authority or used whatever technique, and we were very attentive and calm in that class of the teacher. So for some teachers, we were a source of stress, for others, we weren't. So that also points already a bit to this individual level. Another explanation which could play, and that's something that we are thinking about also, is that it could be due to some methodological issues, and that there could be implicit processes of social comparison at play, which would be predicted also by reference group theory. And that means Often when we try to measure these kind of things, like I experience stress in my work, we try to do a lot of things. We try to make statements on the individual level, and then we also try to make statements on the contextual level and differences between schools. But what does reference group theory says that if you evaluate items like that, like I experience stress in my work, that you often take your reference group as the point of reference for your evaluations. So in this case, for example, if you would ask this to a teacher, then maybe this teacher will compare himself or herself with other colleagues in their school, and they will think I have a bit more stress than this person, a bit less stress than that person. But they don't take into account that, of course, there's a whole landscape of other schools in other contexts that maybe would be different if that would be made salient. So imagine if you would ask an item like, compared to teachers in other schools, I experience stress in my work, then that comparison is made more salient, and then you might, or we would expect that we would maybe see more differences between schools. So that is a more fundamental problem, I think, in multi-level research, that maybe we are not measuring the things how we should measure them, or maybe there are problems with how we are measuring it at the moment, but that's something that we are looking at in the future or would like to investigate. So currently, the school context seems only relevant, but only to a limited extent. Things like structural and school policy variables are relevant, but we always have to keep in mind that what we are doing is really explaining this very small amount of variance, and you can explain a lot of the variance of a very small amount. So what we can conclude on the investigating mental health from a comparative perspective, that it's really important, such comparative perspective, to look into self-perpetuating myths, which maybe are not based on facts. And it's always an important part of scientific research to really problematize assumptions in fields. So sometimes things seem like self-evident, seem like common knowledge, but they are not necessarily supported by evidence, and then it raises more questions once you do find that there are no results. So I think that was it, and thank you for listening to my long explanations, and I give you a happy dog, and I hope my mic was working in the end.